17,493 new positive cases. Over 10,000 of them are in Gauteng. Tragically, another 166 people died of COVID-related causes in the past 24 hours. Let's break down what these latest figures are telling us about the third wave across South Africa. And I'm joined now by Professor Tulio de Oliveira. He's director of CRISP, that's the KwaZulu Natal Research and Innovation Sequencing Platform. Prof, thank you so much for your time. Yet again, the numbers are in, and they are looking really astonishingly high. Gauteng, I think, over 10,000, that's the highest we've ever had. It's really very alarming. And yesterday, of course, it was just under 300 deaths, but today is still very high, 166. So it wasn't an anomaly. What are these numbers saying to you?
Okay, so just to highlight that in addition to the numbers, we have extremely high positivity rate, which is getting as close as the top of our second wave in the country in Gauteng. So in reality, the numbers are just pointing to the tip of the iceberg. Yeah, we do expect the numbers to be 5 to 10 times higher of the real infection. So the numbers in Gauteng is extremely high. We have never seen something like that, either in the first and second wave, which is very concerning, especially as one talk with the physicians and nurses in the ground. It's quite clear that the health system is already overwhelmed, both at private and public system.
You know, we've looked at the graphs and we've just seen that in Gauteng it is literally going up at like a 90-degree angle. What do you think about when we're likely to hit the peak? Is there any science to this? Is it possible to predict?
It is, yeah, at the current restriction levels, yeah, would be very difficult to predict, and probably that will still growing very, very fast. Yeah, so at the moment it's very difficult to predict when we're gonna peak. Yeah. And that, of course, is not a good situation when we cannot see the light at the end of the tunnel at the moment. So it's difficult to say. What is quite clear is that the third wave came much quicker and much extreme than we expected in Gauteng so far, but we also see signs to be spreading to other provinces, with the Western Cape and the Eastern Cape, especially Buffalo City, yeah, also having very fast number of increased cases.
The question is, why is Gauteng being so hard hit? Yes, we know about the hospital problem. We know that perhaps we haven't had restrictions. We know about the complacency. But there's some concern, and we're seeing a lot of reports from people saying, you know, last time round, just one person in my family got it. Now we've all got it. The kids have got it as well. Do you think the circulation not only of the beta variant, which of course was first identified here in South Africa and pushed our second wave, but also the Delta variant, which of course was first identified in India, we know it's here as well. We're also hearing about Delta Plus in India, which seems to be a configuration of what's happening with the beta variant and the Delta variant combined. I mean, I just actually don't know what is going on with these variants, but you are absolutely the person to ask. Are these variants pushing this third wave higher than we expected?
Okay, so just go back to something that we are highlighting for many weeks. Yeah, that we were expecting the third wave to start much stronger in the inland provinces. That what it means, where the province that didn't have a very large second wave, and we are talking about the Northern Cape, the Free State, the Northwest, and Gauteng. Yeah, unfortunately, that prediction that was based on data, it happens. Yeah, but unfortunately happened bigger than we expect. Yeah. At the moment, in relationship with the variants, we do know that we have at least 3 variants circulating in South Africa. What we know is that in the provinces that peak first in the 3rd wave, that's the Northern Cape and the Free State, that was still completely dominating by the Beta variant, yeah. And what we also know that we also detect what we'll call the Delta variant and the Alpha variant in both of these provinces, but also in Gauteng, yeah. At the moment, what we don't know is exactly what is the contribution of each of them to the surge. What we know at the moment is that the Beta still contribute most, but we also see more cases of the other variants. But in despite of all the variants, what we also know, and is very important information, is that the kind of mobility levels, what it means, how much people were mixing or going for shopping or going for restaurants or going to out and about, were even higher than pre-pandemic levels, especially in South Africa and also in the inland provinces in the last few weeks. So what we know, that's a combination of 2 or 3 things. One, it's variants that spread faster, which we still expect the Beta to be dominating, but also it is unfortunately what's happened in many parts of the world of this kind of decreasing, putting the guard down, and almost overcompensating which kind of some of the time lost with social gatherings and going out and about. Yeah.
All right. I have to ask you whether the Beta, Delta and Alpha variants, we know that the Beta is very transmissible, but do they show different symptoms or different symptoms in a different sequence? For example, does one tend to present with a headache, or is it impossible to say?
So that's information that's currently growing around the world. Yeah, for example, we learned about the Beta variant around like 6 months ago. That's the one that was discovered in South Africa, and we knew that the cases, the symptoms were not very different than the other ones. But we also know with the high transmissibility that increased the pressure on the health system very quick. Yeah, on the Delta variant, it is emergent information coming that some of the symptoms may be a little bit different, but honestly, it's a little bit early to say. What we know that is still coronavirus, and that's still the same transmission way, and we also know that is a similar number of population that will get infected, will develop severe symptoms, especially people with comorbidities and people with advanced ages. Yeah. So just to answer simpler to you, it's still the same virus. It is still spreading very, very fast. Yeah. And at the moment, the symptoms are quite similar, which a similar percentage of the population end up with severe symptoms and hospitalized. What we also know, and that's at least one small piece of positive news in all this tragic third wave that's starting to happen in South Africa, is that the vaccines are very effective against the Delta variant, and they also show good effects about the Alpha and Beta variants.
You know, I think everyone is completely shocked, especially if we look at the numbers in Gauteng. In fact, I think the numbers are 10,806 in Gauteng alone in the past 24 hours. But as you say, the other provinces starting to tick up now as well. We know, of course, that the Cabinet, and I spoke to Minister Nathi Mthethwa, they were meant to meet this afternoon, but they are due to meet quite soon. They will be discussing restrictions. It's inevitable, I think, that new restrictions will have to come into force. What do you think at this stage, with hospitalizations just peaking massively, what will work in terms of restrictions in your view? What can we do?
Yes, of course, that first restrictions is almost the last resource that one have. Yeah, I am personally not a big fan of restrictions, especially when's not needed. Yeah, but unfortunately, I do personally think, and that's my personal opinion, not as a member of the Ministerial Advisory Committee, but my opinion as a scientist, that unfortunately, we're going to have to release to increase restrictions just to decrease the burden of the hospitals. Otherwise, it's going to affect not only people with COVID, but anyone that need any kind of hospitalization. Yeah, and unfortunately, I think that we're going to have to think that very seriously as a country and also as an individual and within our own families.
All right. Well, thank you so much for talking to us this evening. That was Professor Tulio de Oliveira, Director of the KwaZulu-Natal Research and Innovation Sequencing Project. And I'm just going to pause and go through the numbers once again, because it is truly alarming. And I'm going to go through the provinces. Here in Gauteng, 10,806 new cases in the past 24 hours. The Western Cape has jumped alarmingly as well. They were just under or around 1,000 a day ago. They're now on 1,778 new cases. That is followed by the Northwest, 1,018 new cases, and then KwaZulu-Natal just under 1,917 cases. So the cases are very, very high, and it doesn't look like it's slowing down at all. So if you can, stay at home. If you can, stay away from groups. It is absolutely imperative while we await a decision from the presidency, from the National Coronavirus Command Council, to stay away from crowds, to stop this wild transmission.